I confirm that's 101 and 136 Kansas High Police, correct?
I have been in EMS total for approximately 10 years now. I've been in EMT for roughly 7 or 8 years now. I was always getting hurt when I was younger. I'm super clumsy, so figured if I was in the medical field, I could fix myself when I hurt myself. I decided to join my local first aid squad because my mom was like, I think that would be a good way to support your college applications, and kind of fell in love with EMS from there.
It's definitely different. I mean, she gets up different times of the day. There's days I don't even see her. I'm very proud of her, you know, going to work every day, seeing young kids to older people, and dealing with the family members too while she's on scene. It can't be easy. It's pretty tough. I don't know how she does it because I wouldn't be able to.
Even after 29 years, I still enjoy coming to work every day. Always having something different, always doing something different, and having really, I don't say changed somebody's life, but helped them out. You know, they call 911 because they're having some type of medical emergency, and to them it's everything. Take 5 minutes to be nice to somebody and talk to them and settle them down. They may not necessarily need our services, but you know, if they want to go to the hospital, we have an ambulance, a BLS truck shows up, they'll take you and see what's going on.
Lauren and I became consistent partners probably for, I think, 1.5 years now. We communicate without even talking. Like, I know what she's gonna do, I know what I'm gonna do. And then when we get in the back of the ambulance and we both verbally acknowledge what we're gonna do from then on. Every day has potential to be great and also potential to be a horrible day. You just never know.
We are getting ready to go on an abdominal pain call. The notes on the CAD says that it's a 71-year-old female.
Hello. Do you want to come down? And then we'll check you out in the ambulance, or do you want us to check you out there? You want to come down? Okay, here, honey. Let me help you. You're going to vomit again? You have a vomit bag? Okay, honey. I could take this here. Give me 2 seconds. We're gonna keep that with us. Hold that. Thank you. Let me just get gloves on, darling. What's your name, honey? Jerry? Jerice? Okay. I'm Casey.
I think I've had her before.
Okay, honey. Okay, when you're ready. I got you. Okay. No worries.
We had her in July.
It's dark brown? Does it look like coffee? Grounds?
No, it's dark.
Just dark.
Say something with me, huh? Well, no, bad stomach pains.
All right, Joyce.
Thank you.
All right, Joyce. So you're gonna have a seat right here.
Okay, honey.
Oh boy, it hurts so bad.
Do you want to lean back or sit up?
Okay.
Okay.
I'm gonna help you with your legs. Ready? 1, 2, 3, up.
And then we're gonna reposition you.
Okay. Ready? That's your. Ready? 2, 3. Better? Do you want to sit up more, or you want to lay down more?
Yeah, it feels like something's cutting.
Okay.
I'll put the seatbelt a little looser so it's not so tight on your stomach.
2 years ago, I had surgery yes, I had
Yeah.
Right
For
now.
what?
obstruction of the back of the
Oh, okay.
Communications 231, 242,
little house on that.
Aww.
I'll take her back. That's not cheap.
Super cute.
Yep.
Yep, Hackensack. I have your purse. Your purse is heavy?
Yeah, even without stuff in it.
But it has everything you need. Can I take a blood pressure on either side? Okay.
Yeah, I was admitted last week, so my blood pressure was real low.
Okay. Last week it was?
Last week?
Yeah, but now, I never had low blood pressure.
Okay.
So they kept me there and gave me food.
Okay.
Have you been drinking enough fluids?
I had, my head and like, shit.
Because you've been so nauseous.
Well, I tried to drink some water yesterday. As soon as I took a sip,
Came right out.
everything came out.
Okay. Gonna take a temperature.
Oh, having pains. It was just like swelling up right here.
Under your tongue, close your mouth. Perfect. 98.9. I'm gonna open that. Okay, honey.
I'm sorry, where was it? It was straight
Cross.
upper,
Yeah, straight across.
lower.
Here
So
Up
like
here?
the whole thing.
and from here to here.
And then the whole everything.
Yeah,
Yeah, okay.
Looks a little distended.
We do look similar.
There's like two dots right here that
Do you feel like you're more bloated than usual? Are you about
We're like a little rigid
feel
too.
like the true
It's hard. Oh, sorry, honey.
Ooh, girl.
I'm so sorry.
Yeah.
Yeah. Okay. We're rigid too.
we're good?
Have you been having normal bowel movements? Yeah. Okay. When was the last time you had a bowel movement? This morning. And it was normal? Okay. No diarrhea? Okay. You good back here?
Yeah.
Okay. We are going to Hackensack for her abdominal pain. She's been vomiting for a day and a half now. And it's like dark colored vomit, so she's in a lot of pain too. Your adrenaline's always going to be pumping through when the lights and sirens are going. Depending on the call, depending on whether or not you know kind of the notes or what's going to happen on the call, definitely gets your adrenaline pumping. On the more calmer calls, I feel like you still don't know what's on the other side of the door. So like you could go in thinking one thing's going to happen and you find the complete opposite, which happens 95% of the time. 71-year-old female. She's complaining of abdominal pain. She's been vomiting for the past 24 hours. Her vomit's like dark brown. She was recently here admitted 2 weeks ago for pneumonia. Okay, honey. I'm gonna
Give
scoot you
yourself
over.
a nice big hug. We're gonna move you on over.
Ready?
You have a strap to do it.
It's okay. We got you.
We
You
got
just sit
you.
there and look pretty.
Ready?
I like to joke that I lift people for a living. We're lifting people off the ground, carrying people out of houses, carrying people down the stairs. So our job is very physically demanding. It was nice that she was like, could walk. A lot of the times they don't want to walk, so then we have to like carry them down. But that's a pretty routine call. Some people think that they can do this job when in reality it takes a special kind of person to do this job.
Probably the worst call I've ever had, at least emotionally, was my cousin. We're around the house, I see my cousin's husband out in front. Apparently she had shortness of breath, she couldn't breathe. She's talking fine, she's like, hey, a little shortness of breath, but it passed. I turn around and Mary's head back, barely breathing, unresponsive. Got pulses back, but eventually, we did cardiac arrest again, then just let her go. That one almost made me quit. I remember her from growing up. His issue was kind of like just weakness, not feeling great, kind of sick for several days. And then he had developed chest pain, which was getting worse over the last couple of days. His blood pressure was through the roof. He admitted to be non-compliant with his medications. So I think it probably was related to his blood pressure. His pressure was like 180 systolic over like 180 over 120. He had blood in his eye, which my guess would be probably from a ruptured vessel, probably because his pressure is so friggin' high. My thought is that his pressure is just so out of control, causing the chest pain and all those other issues. So he really needs to be compliance medications get that under control, you probably would feel better. But my gut would tell me that all his issues relate to his blood pressure. Since he takes it sporadically, his pressure's probably been climbing up for the last couple of days to the point that it got to this morning they couldn't take it anymore. The other concern too was his schizophrenic history of having the voices tell him that the voices want to hurt him, and also hearing other noises that aren't there.
I'm just worried schizophrenia is going to come back to you.
Okay, how bad is schizophrenia? Like, is it dangerous, or are you just
I was in a mental ward.
Okay.
Because
Relax.
I've
You're
been,
good.
no, I've been hearing fake noises and voices.
How long's that been on for?
A couple months.
Okay, did they tell you anything?
Basically, they want to kill me.
Okay. So you're aware of it, so that's good. Okay, man.
But no.
Got it. Patient, right? Yes, sir.
You got it.
Give me some medicine. Once you look, open your mouth, lift up your tongue. Are they going to base short too? Yes. Alright, that's some nitroglycerin. We'll see if it helps out your chest discomfort, see if it helps out your blood pressure. Your pressure's up. Alright?
Flat spot in both eyes.
Okay, so that hasn't changed.
Well, my vision's been, of course, deteriorating over the years.
I'm saying the last 24, 40 hours hasn't really been noticeable change. It hasn't gotten significantly worse or anything with the bleeding of the eye kind of thing. Okay. Let's fix this mask for you.
I feel my pulse in all my veins.
Yeah, well, that's because your pressure's up. Your heart's a little fast, it's like 128, so that's faster than what it should be, but not crazy fast, not concerned with it per se.
And that's part of the problem with my hand is...
Yeah, it's taking your blood pressure, okay? Relax. It's just...
I can't move my fingers.
Okay. Part of this is breathing so fast, okay? I'm taking your blood pressure too, alright? Your blood pressure's high, so the cuff's gonna go high, okay? You're doing fine, okay? I don't see any changes on your EKG. Doesn't mean there's nothing wrong with your heart, but there's nothing that's obvious right now, okay?
I want to be able to move my hand.
Yeah, just let's...
My fingers...
I know. Okay. Let the blood pressure stop going, and then we'll deal with this, okay? Part of sometimes when your hand gets like that, it's because you breathe so fast. And it's called carpal spasms. So your fingers, the muscle in your fingers spasm.
I've already been to like 2 mental wards.
Yeah. All right.
I don't like too many painkillers.
I hear you. I don't blame you. So that's a pressure you said, right? In your chest?
I'm gonna need a Haldol or something.
For what?
To calm me down, a sedative.
Okay.
If it's not compliance medication, that's not going to help. You know, and that's not with him with the schizophrenia or anything. So he really needs to hone in his medications and really figure out a system that he's going to be good with and compliant, because that's the way it's going to, he's going to get better.
So how's that chest discomfort?
Concerningly bad.
Okay. Why concern is it better? Let me ask you that. Instead of giving that medicine.
I think maybe.
Okay. So it's a step in the right direction. Concerningly bad, it's understandable, but as long as it's getting better, that's what I want. Alright?
So worried I was going to have a heart attack.
Well, I'm not. Could you bring it here for me, please? I'm not saying you're not. All I'm saying is that what I look for on my heart monitor, nothing shows on my monitor. There's other types of heart attacks that can be going on that they have to know with blood tests and more EKGs. But right now, nothing's showing up. Okay? I think the biggest issue is your pressure. Your pressure's really up. It was 180 over 120 last pressure I got, which could explain the blood in your eye. And it could explain the chest pain as well. So, have you been taking your medication like you're supposed to?
Not regularly, I'm just bad at medication management.
Alright, well I think you need to work on that. You're 154, 105 right now. So I'm going to give you one more spray nitro before we go in. You got still good yeah. So Des will give you one more spray for me, and then we'll bring you inside the hospital, okay?
Alright. Lift your tongue up one more time, okay? Lift it up towards the back. There you go.
Thank you. Alrighty. Here, ditch still right here.
For your jacket.
Is it your jacket?
I'll find it.
31, 374,
Oh, right there by the blue bag. By your hat.
Okay.
Sir. All right, and we're here. All right. Let's get you inside, and we'll get you all taken care of. All right. 41813. As much as it could be stressful, and there's a lot of things going on, a really sick patient that has a lot of stuff going on is that you have to use your brain for. It's kind of nice.
We are waiting for a luncheon of recognition for our SCTU nurse, George. He was awarded nationally with a nursing award, and we're just here today congratulating him on this award.
EMS tends to be a small knit group, and everyone tends to know everyone because we are a smaller group, but it's definitely a family.
Your partner makes a lot for this job. You have a real good partner. It makes the job so easy. You know, I've been lucky that throughout my career, I've had almost all good partners.
I had COVID at the beginning of October. I have bad asthma on top of that. So like, I had so many people reach out to me that like are like, hey, do you need anything? Can I get you anything? Are you okay? Like, they have no problem picking up a shift for you or, you know, coming to your house and bringing you things. So it's a nice family, for sure.
We are arriving on scene for generalized weakness, but that's not to say that they're not having trouble breathing, so we're gonna bring both of our bags of equipment.
That call, we picked him up at the cancer center. He had like stage 4 cancer. He wasn't drinking enough water, wasn't eating food, he was skin and bones.
All right.
I'm gonna leave this here.
Yeah,
That room.
that's probably right here. What's going on with the patient?
Have the papers.
Sure, I'll take that.
I have the last consultation in the.
Perfect.
He's a new patient for us. He came from the inpatient. He was admitted because his diagnosis is GE junction.
Okay.
He was in the consultation after inpatient consultation.
Okay.
He has history of low hemoglobin. He said he was 3 on July. He received a couple of units. We couldn't do the vitals, the labs today because we do after they see the doctor. So
Yeah.
obviously he
Okay.
approached that. So the reason he is going to be admitted is to be stabilized for the transition for hospice. I already contacted the Lati, the hospice
Okay.
nurse.
Okay.
He will need fluids, blood transfusion, and then
Hospice. Okay.
Okay.
Got you.
And I gave it to Margaret King, the doctor in the ER. So
Okay,
whatever.
perfect. So we don't know what his current hemoglobin is?
No.
Okay. But he's just
He's
feeling very weak.
Yeah,
And he's very pale.
Dry, pale.
Okay. Okay. 25?
Yeah.
Okay. We deal with it all the time. We see these patients and we know that like the end is near, but the family might not have accepted it yet or not have recognized like this is what we're doing, you know? I'm just gonna get vitals on him really quickly. I'm just gonna take your vitals, okay? Can I take a blood pressure in this arm? Perfect. Okay. Okay.
Oh, hi, Kim. Hi. Yes, so he's getting ready to go over to the emergency room right now. You know, like Benjamin.
I'm gonna do that one more time, okay?
Okay.
Not only are you dealing with these patients and like you're trying to do your best to like not jostle them so much because they're in an incredible amount of pain from the treatments, from the cancer, but also like to just show compassion. (135) to my comm, can I have ALS for hypotension?
Up here, 135.
Thanks.
I got this.
Okay. You want to double it since he's tall?
Yeah.
Ready? 1, 2, 3, up! good?
Yeah.
Okay. (135) transporting Hackensack.
135 transporting Hackensack.
Go ahead. Go ahead. Okay.
Your incident has been updated.
You're thinking you're having a great day and whatnot, and then you pick up someone like him, and it's sad. He's dying. It just, you know, and it's kind of the thing that you acknowledge it then and there. You do the best you can to like make him as comfortable as you can, and then you kind of have to just like move on, unfortunately, because you've got other patients for the rest of the day. So, you know, that could be a little disheartening too. He was dying, for sure. I don't know if he knows that, but he's dying. The doctor discussed it with us that he was going to the hospital just to get stabilized, and then they were transitioning him to hospice care. So that like smell that you smell, that was the smell of someone dying. His body is shutting down. You have good days and bad days, you know? Going through a traumatic scene, I feel like you don't realize it's traumatic until the after effects, right? The adrenaline's kind of going, you're doing your job, you're keeping your cool, you're doing what you need to do and what needs to get done, and then it's the after effects of it. So then it's after you leave them, drop them off the hospital, or you know, you end up pronouncing them, whatever it may be, then you go back and you think about the call. And you think, well, what if I did this? What if I did that, you know? And I feel like that kind of tends to be a little heavy sometimes. As a 911 EMT, we all share that same experience. A week ago, I ended up doing CPR on a 26-year-old that we ended up having to pronounce on scene. And then you have to tell the family that, I'm so sorry that your son died, you know, like we did everything that we could. And he was nonverbal, autistic, 26-year-old. And that's definitely a harder day at work.
Probably 7 or 8 months I was a medic. And we had a 4-year-old accidental hanging. It was friggin' brutal. I mean, supposedly from what I remember and from what they said, you know, Dad made the bunk bed for her. It wasn't right to code. She slipped between the mattress and the side rail on the top bunk and hung herself. Don't know how long she was there for, probably a while based off the way she presented to us. And then we got her to the hospital and found out later on talking to the nurse that the family had an autistic child and this girl was the only one that was able to get through to the kid. I can still picture like it was yesterday. You know, it screws with you. She had a cardiac catheterization done recently. During the procedure, they perfed one of the vessels or arteries in the heart, didn't recognize it, and she ended up with blood in the pericardium, which is the sac that surrounds the heart. Did she have a heart attack, or what caused them to do the cardiac catheterization?
She went for a calcium scoring test,
Okay.
and the cardiologist found that it was 90%.
Gotcha.
blockage.
Okay. The heart bled out, like if you cut your arm kind of thing. It got collected in the sac and causes other things such as low blood pressure, could be chest pain, heart rate could be slowed down. So she had, I guess, some weakness and some complications. Went to Bayshore, she wasn't feeling well. Bayshore picked up on it and then had to do what's called a cardiac window to go up and basically drain the fluid out of the pericardial sac. She has a significant recent history of cardiac issues, and it would be in weakness without knowing if the leak actually sealed over. Who knows what's going on. We're just gonna put an IV in her and we can give her fluids and medications, that kind of thing. So ma'am, I'm gonna start an IV on you, okay? This event has to give you some medications or fluids. I have a nice way to do it. All right. So you have no discomfort now, correct? You just kind of just weakness?
So completely.
Okay. All right, out of breath, is it from like is it, like it's not necessarily like a shortness of breath as much just like a tired? Okay.
Okay.
And out of breath walking through stuff.
Okay. What's the matter? It's all right. Sure, I understand it, but hey, listen. Who, your husband? Hey, you know, that's what our spouse is there for. Lean on when we need it, okay? I mean, you'd rather have somebody there that can do everything for you, or somebody there that doesn't care, is not going to pay attention, and you're stuck to fend for yourself.
No, of course I want. I feel
Yeah. You know what? How long have you been married for?
56 years.
So I'm thinking he's loved you for at least 56 years, if not a little longer, and he would do whatever you need. He gave me all the information I needed. He was very well educated in what's going on with you. All right? So you're good. That's what he's there for. Hey, you know what? I know it sucks. I know it's hard to sit back and do nothing, but sit back and do nothing. Let him do his thing and help you out a little bit, all right? Because the more you sit back and do nothing and relax, the better off you're going to be in the long run. All right?
You want her hooked up to OC at all?
Not yet. She was like 90s to 100. I just put that on just the end title.
Okay, that's why I understand.
Why can't you sleep?
My mind is too active.
Okay. So it's not like you lay flat, get shorter breath. You just can't settle down. All right. Well, yeah, like I say, you've been through a lot.
I'm just looking.
Nah, she's just trying to peek around for me too. See, we got vein-wise.
You're lucky they were like 40. They can find food.
I mean, one or two I can choose from over here, but looks like they took all the good spots. All right, hold still. Just sit there. You can stay right there because I'm just going to go lower here. Let's see here. What? I kneel on you. You good? What's the pressure over there?
117.66.
All right. All right. Hold still. Big pinch here, okay?
That's in the mall. You're going to be pulling into Central State.
You are not. Let's see.
Nobody ever said I was easy.
This is true. Let's see what we do here. Kind of the blood pressure cuff again. I want to see your pressure is over here.
Yeah.
And then throw in a 500 bag. Yeah, it should be in the main part of the bag there. What happens when you take Augmentin?
I was giving Augmentin because I had a bad sore throat.
Uh-huh.
And about 2 weeks later, I got.
Just give me 1 second.
See this.
Give us 1 second.
Yeah, is it pressure 88 something?
86.59.
There's a pen top or something.
It's okay. Nope, it's just garbage. We do
Portable
that.
oxygen bottle?
No, she's not on oxygen.
Just on the CO2.
Yeah. All right, we're all set. Thank you.
This is what they call an alpha response. It is a downgraded response, but they can often turn into messy calls. So we'll see what this is.
Okay.
I pulled up and she was sitting down.
Uh-huh.
Said she fell and her knee gave way.
Okay.
And then she was also complaining of like a faint, like weak feeling.
Okay.
Okay. I'm going to.
Yeah, you want to go
bring
grab
it
it?
around.
Yep.
Yep.
Here. On that call, she was a middle-aged woman.
I don't want to go to this hospital.
Okay. It looks like you were just there. She had a chronic history of pain, which I get it. Being in pain all the time absolutely sucks. Did you
just discharged me? They don't.
Did you get discharged or did you walk out?
They discharged me. I needed to use the phone, and I couldn't use the phone. I need.
Do you have discharge paperwork?
No, I don't know. I dropped it somewhere.
Okay. So what are you feeling right now? What brought you to the hospital initially?
Pain in my legs.
Okay.
And my hip.
Okay. What kind of medical history do you have?
Lupus.
Lupus. Okay. And what happened right here?
Where?
Right here. How did we get right here?
I was trying to get across the street. I was not fast enough.
Okay.
I felt my knee giving out on me, and I just sat down on the ground.
Okay.
And then I started to feel weak and dizzy, and so I laid down.
Okay. New Jersey's in a epidemic of opioid abuse, right? So you ask certain questions like, when was your prescription filled? How often are you supposed to take your medication? When is it supposed to be refilled again, right? So like in her instance, her pain medication wasn't supposed to be refilled for like a couple days and or like a week or two. So that means that you're not taking the pain medication appropriately, because if you were taking it appropriately, you wouldn't be out of pain medication. So you don't have any of your discharge paperwork?
No.
Did they give you paperwork?
I must have dropped them.
Did they give you paperwork, or did they not give you paperwork?
I think they gave it to me.
You think that they gave it to you? Do you know what today is?
No, is it Tuesday?
Okay. What year is it?
23.
23? Okay. Who's the president?
I don't know.
We're gonna get you onto a stretcher, okay? Okay, Jill, can you bend your knees?
Good.
Okay, but we need
As you can, Mama.
we need you to bend your knees to help us stand you up.
Nice and
My
slow.
hip.
Which one, left or right?
My right hip.
But you have chronic pain there.
Yeah.
Okay. This is not new pain then.
Ow.
Okay, but I'm just trying to make sure before we start moving you further. Is that new pain or is it
It's new.
It's new.
Oh, my hip.
It's new pain in your hip. Okay, can you lay back down for me then?
No, I want up.
Okay.
Oh. Look.
I'm cold. I know. It's a little chilly today. I have your stuff.
Your bag is next to
Can you
our
raise
stuff.
up your arms for me? I don't want to tie you down. There's no need. Can you raise your arms for me? Thank you.
I get it. You're sick. That's fair. You're in pain. I'm sorry, but like at some point, you can tell that they're like seeking pain medication. I'll get you a blanket in 2 seconds, hon. There you go. Sorry.
Almost.
Yeah.
So while we were at Hackensack, they gave her Motrin.
Yeah. Is that all you got? At Hackensack?
Yes,
It was Motrin. Okay. So you came to the hospital today for chronic pain? For your chronic hip pain?
Yeah.
Yes, okay. And then while you were there, they gave you Motrin and then they sent you on your way?
Yes.
Okay. Do you have a follow-up with like a pain management person?
No, I have to go back to my medical doctor in a week.
Oh, okay. On a scale of 0 to 10, 10 being the worst pain ever.
10.
A 10. So the Motrin didn't help at all that they gave you?
No.
No. Did you let them know that when you were there?
Yeah.
And what did they say?
They said there's nothing they could do.
Okay. Where did you go when you were? What current medications do you take? I have amlodipine, losartan, and Lyrica.
Yeah.
Yeah. Anything else?
Oxycodone.
Oxy. Okay.
I don't have it.
Okay. You ran out? Yeah. Are you taking it as prescribed, or are you taking more than what's prescribed?
I'm taking it as prescribed.
She was probably abusing her pain medication for a long period of time. So like, is me talking to her gonna do anything? Probably not, you know, but you still try and educate them so they're not in this situation. Where do you live now?
I'm homeless.
Oh, okay. Well, we're here. I'll let them know everything that you told me, and hopefully we'll get you feeling better, okay?
You know, I'm looking at ideas now to try and learn something else for like a retirement job. What else I can see myself doing is like a fire job. Either this or that. One of the others would be what I would have done. You know, like I said, I enjoy coming to work.
Police and fire get a lot of recognition, and ambulance doesn't really get as much recognition. A lot of us work multiple jobs to just like support ourselves and pay our bills. So like that's unfortunate. On the easy days, I'm in school, so is Lauren. So we both tend to bring homework with us to do. I am in nursing school. I am a senior currently at Chamberlain University. I'm in an accelerated program, so I've been in nursing school for 2 years. And then I'm hopeful to take the NCLEX, which is my boards, in end of January, beginning of February, and start my nursing career. I'm applying for residency program at Hackensack.
That's it. I should go finish up my charts, and then that's it. Let's go home time.